Welcome to the High-Tech Dental Seminar information session for the upcoming Step-by-Step Dental Implants course. My name is Beth. I am the Program Coordinator for High-Tech Dental Seminars. Today is your opportunity to meet some of the course facilitators who will talk to you a little about what it takes to learn dental implants here in Canada, first giving you some useful tips considering which course is right for you, and then talking about the journey of learning how to perform implants. At the end, we'll have some time for you to ask questions to our hosts. Please ensure your camera and microphone are turned off and post your comments and questions to the chat section. We aim to answer all of your questions today, but if we don't, we will respond to you privately after the session. Today's session is being recorded. Today, I'm joined by Dr. Amin and Dr. Ali, who are the primary instructors for the dental implants course. We also have Nicole, who is the manager and instructors for the dental staff module, and a very special guest, Dr. Sammy, a current participant of the dental implants course. Feel free to ask your questions to a specific speaker or keep it general. Okay, I am happy to introduce you to your first speaker, Dr. Amin Al-Abaidi, our lead instructor, who will give you some tips on deciding which dental implant course is right for you. Dr. Amin has more than 20 years of experience in dental surgery and specializes in implant and cosmetic dentistry. He currently operates 4 practices across Ontario and has the pleasure of working with hundreds of dentists and thousands of patients spanning 4 continents. Welcome, Dr. Amin.
Thank you so much, Beth, for the introduction. Hi, everyone, and welcome to our the webinar for high-tech dental seminar, step-by-step dental implants. I believe we are here to know about how we should select the best course for your implant journey, because it's really important to know why should I choose this, or what are the criteria that I have to keep in mind when I'm going to select my first implant course. So my journey in implant go back to 2008 when I decided to take some courses. So I took some courses in the States, in the Caribbean, in India even. Spent like 2 weeks here, a week there. So when I go back to that time, when I came back and I wanted to place my implants, I found it very hard, because implant dentistry is not about like you go in your dental office and you find a patient there and then you go and do the surgery. It is really a complete package. It starts from who called the office. How would you introduce yourself that you're doing implant in your office? How to bring those patients to your office? And then who is going to talk to your patients about dental implants regarding financial, what is the implant, the treatment coordination, and then booking this implant with you for, planning the case, and also like the inventory and what type of implants better for you in some cases. So it's a complete package. And when I started my few implant cases in the beginning, I had 20 implants in that one of the courses. But when I came back, unfortunately, it was so hard to start, taking in consideration there is no mentorship available. I don't know what kind of implant I should choose for myself. What is the inventory, which is a very important thing to consider when you're trying to do your implant. And of course, your staff are not on the same page, and it was just a struggle for me. So taking this in consideration, Canadian-based courses will teach you, number one, what is the market here? What does our patient needs here? Number one, that's very important thing. How can you bring those patients? There are tons of offices, and there are thousands of dentists who are placing implants. How can you get those implants? And Canadian-based courses also will teach you the very important thing, which is, for example, dental charting. I used to like go to the States. Nobody teach you how to chart the treatment you done after you finish the treatment. Charting is a very important part of the process, and it will protect you, and also consent forms, for example. And that's why here in Canada we know the regulatory bodies requirements, the RCDSO. So we will teach you A to Z actually what are the charting requirement, consent requirements, and what are the needs for the patient. So there is a business part, staff part, implant skills, of course, part, and then documentation part. So let's go to the second slide, which is the requirement for the RCDSO. Everyone should know from this webinar that if you are a dentist, a general dentist, and you are willing to just do the surgical part, you should have at least minimum 35 hours training in surgery. Like if you say, I want to just do the restorative part, for example, again, you should have 35 CE points. Altogether, combined, if you want to place the implant and restore it, you should have minimum requirement of 70 hours of didactic and hands-on training. In our residency, actually, you will be with us for 9 months, and you will really exceed the requirements because we are teaching over like around 140 CE points, which will exceed the requirement for the RCDSO. Patience is is very important as well when you are going to choose your courses, especially in Canada, because most courses, and we know that they will not be able to provide you with patients. Even if they bring the patients, they will put some notes in the registration saying that if the patient didn't show up or we couldn't get you the patient, then you should be responsible to bring your own patient. In the beginning, to be honest, it's very hard to find people to practice and to place implants. In our course, we are going to let you practice on patients, and we will be providing minimum of 3 cases, plus you will assist in 3 cases, so totaling of 6. In our last course of surgical placement of implants, our attendees, some of them even placed around 8 or 9 implants, and they assisted with another 3 or 4 implants. So definitely the minimum we are going to provide you with is 3 cases. You are doing the implants, and 3 cases your colleague or partner you will be assisting in another 3 cases, so that you will have 6 complete cases. The other thing we try to provide in this course as well is that no one room where there are 2 attendees, we structure the course so that no one room will stay without a mentor like inside the room with them. In some courses, sometimes the number of the attendees are more than the numbers of the facilitators or the trainers. So this will lead into one mentor guiding 2 rooms, which I found, and when I attended some courses, it's very hard because you're in the middle of surgery and you want someone to help you or guide you. So we designed the course so that every single person will have mentor with them. And this is very important during especially starting how to talk to the patients, how to give the local anesthesia, what local anesthesia we are going to use, what type of anesthesia, how we take the medical history from the patients, and we use surgical guides as well. So how to use their surgical guides. So patience is very important factor. If you guys decided to go and choose an implant course for you to start the journey, Now this comes to the facility Dentsply Sirona. So we partnered with Dentsply Academy, and it's a state-of-the-art academy actually, and it is one of the first academy in Canada, not only on Ontario, but in Canada, that provide the atmosphere for, like a great atmosphere for training. The facility there have all the high-tech technology to up-to-date technologies. And as you see here in the video, the simulation lab has the same environment where you are going to place the implant in your dental office. So saying that, as you see in the photo here, typodont is really way simulating the like your real life. So the sitting position, which I found it very, very difficult when I came back to place my first implant. Where should I sit? Is it 9 position? Is it 11? Is it 12? Angulation, everything is very important to practice in these typodonts, not sitting on tables. And that's what I wanted to say to you guys. These labs, simulation lab, provided with microscopes as well, and all digital technology. When you go to a course, basically here, even in Canada, sometimes you end up paying for to go to a hotel room booked, or maybe any other place, but you are going to sit on a table and you're going to be handed the typodont, and then maybe it's a peg, maybe it's like a whatever plastic typodont it is. And then you're gonna start drilling on a table. And believe me, guys, and take it from a person who's been doing that for a long time. The first moment you go back to your office, you'll be like, okay, where should I sit really? It is very stressful. While when we prepared our attendees in these labs really, and we spent like over 3 months with them, training, and they really, when they went to the surgeries, they were really very well prepared, like really well prepared. The cases were very well selected, and it wasn't just simple cases. We did many full arch implants in that course. I would say over eight cases of full arch, each like two dentists, each group. They were able to successfully restore full arch by themselves. So when you choose again, these are factors, like that will add up to your list. What should when I choose the course, where I'm going to do the course? Am I going to sit on a table and do it? Or am I going to have like a facility like this academy that exactly simulate your dental work life? I wanted you just to see the communication, like the communication with our communication and support to our resident. It doesn't stop at the course. After the surgical course, our residents and dentists, they become alumni, and they can even really send us please, I want to ask about this case. What should I do? How can I start? What do you think about the case? Should I send it for a CT scan? What should I do? Surgical guide. So we are going to support you not only in the course, and that's why I'm saying Canadian course, because guys, we are here, we are based in Canada. We can also communicate, we can guide you through, even when you go to do your first, you do your first implants in your office. We are always there for you. I talked about patient. So this course is really structured in a way so that and it is also sponsored by big companies like Dentsply Sirona and Patterson. And that's why we are not going to charge. For example, I'll tell you some fees. You go to the course, you're registered, you paid your fees, and then after that, they will tell you, oh, you have to pay the lab fees for your patient. We're not providing you that. Or you have to go and buy your instruments. Some instruments you have to bring it in order for you to practice on the surgeries. So there are some fees that will will arise after you register for the course, especially, I mean, I'm not saying most, but I'm sure that there are the majority of courses here, they let the participant to pay for the patient lab fees, for example, because when we restore the implants, we have to do, when we place the implants, sorry, we have to restore them. And at the time of restoration, they will tell you, okay, you go pay the lab. Or for the surgical part, they will tell you, you have to buy this kit of surgery in order for you to place the implant. Everything will be provided for you with no extra charge. Your study materials, your surgical tools, your drills, your hand pieces, your motors, and also the lab fees will be covered in this course. This is very important, guys. You need to know the lab fees is covered. Okay, so you pay nothing after you register for the course. My main thing, this is my what I love in dentistry planning. And in this course, we spend lots of hours, guys, teaching you conventional, but and guided surgery, and how to use the CBCT scan. And as you see in the photo, like in the X-ray here, you can place implant conventional using 2-dimension X-ray. But the end result, when it comes to me in my office, I can see that the whole implant, there is no bone covering. And this is the beauty of the guided surgery, where we use the surgical guide in order to place the implant in the right spot. No pain after the procedure, less pain because we're not doing any flaps or anything, just punch and place the implants. And you can tell from the photo, photos there, like, yes, you place the implant, but after 3 years, how these implants were going to look like. So our goal is to take you through this guided surgery journey. And I found many of the residents now, they contact me and they are preparing their guides. They are very happy because you know what, whatever you planned in this CBCT scan, it's exactly in the same spot where you're going to find it in the patient mouth. There is no errors. And that's what we want to teach, something predictable and consistent, successful cases. And finally, I got this quote. In theory, there is no difference between theory and practice, but in practice, there is. I believe all our attendants, they said it's completely different when they were in the patient mouth, raising flaps, putting the surgical guides. It was completely different from doing the practical side than the theory. Thank you so much, guys, and I'll be ready for any questions if you would like to answer.
Thank you so much, Dr. Amin. That was fantastic. We do have a question, actually, and I'm so glad this question got asked, because this was a big thing for me when I was hearing about this course. So Dr. Nick has asked, so you get 3 cases provided and you assist on another 3 with a partner. Can you bring your own patients, though? Like if I had a patient, can I bring them to the course, or is it only allowed the ones that you provide?
Oh, definitely, definitely. We already asked our attendees, if you have your own patients, you can bring them to the course. It's funny, one of my attendees, even after we finished the module, the 4th module for surgery, he brought his wife he brought it to my office actually to practice, and we did surgical guides, and it's yeah, of course, yes.
And Dr. Nick's got another question about fees here. So you did mention the no hidden fees, but he does say, is there an extra fee for your extra patient if I bring an extra patient, or is that also covered?
It will be all covered.
That's
I
fantastic.
told you, yeah, we're covering the fees for the lab, we're covering the fees for the parts. Everything is covered in this course.
That is fantastic. And I'm really glad, thank you, Dr. Nick, for asking that question, because it is one of the biggest things I think that I learned was this is really rare for Canada to actually provide the patients. It's really hard to find a course that will do that for you. And for this course, you have your patient from the beginning, from prepping them and doing their scans and getting everything ready, all the way through to their recovery and restoration and seeing how it ends for the whole 9 months. I think that's a huge piece that I just wanted to bring out there. Dr. Nadia, we have a question from Dr. Nadia. How many patients are we working on? I think Nadia might have joined us a little bit later.
So Dr. Nadia, yes, we are covering all the surgical and prosthetic part. We are covering, we are exceeding the requirement of RCDSO. The requirement of RCDSO is 70 CE points, 35 for the prosthetic, 35 for the surgical. Our course is 140 CE point. So yes, you are going to have all the CE points actually exceeding, you're doubling your CE point, the requirement. And also we will provide you with the cases, yes, 3 cases, and you will assist in the 3 cases as well. So with your partner, so everyone, like the groups are divided into 2. So you will be having an assistant in the group, and you will be doing 3 cases, and the other partner 3 cases, and you're gonna guys alternate between the patients. And the patients are different cases, different scenarios. We had full arch, we had like a simple implant, and we have bridge, we have guided surgery, conventional surgery.
Yeah, absolutely. And I think we'll hear from Dr. Sammy as well what that experience is like when you're working on so many different patients from different angles. Dr. Nick has asked one more question. So you said it's 1 instructor per 2 students.
That's completely true. Yeah, and it's like we designed the course so each room with 2 dentists working, and there's a mentor inside the room with them. And this is really, guys, this is a key. I mean, and for those who didn't attend a course and you're waiting for someone because you started the surgery and you want to finish and you don't know, or sometimes you do something wrong and because someone is not there in the room for you, it's really important to be on top of the people. We took really very the details through the process because we myself struggled on these points. And I found it you know what, when I want to structure a course, I would have to take in consideration all the pain I got in the past.
Excellent. And thank you very much, Dr. Nick and Dr. Nadia. And no question is a stupid question, so keep them coming. Yeah. As we continue, I'm very happy to introduce our other facilitator, Dr. Ali. So Dr. Ali has over 10 years experience restoring and healing a person's oral health and bringing out their biggest smile. He is the owner of 2 practices and works alongside Dr. Amin as an associate. His commitment to refining his skills and providing comfortable patient care is how he gives back to his community. Thank you, Dr. Ali.
All right. Thank you, everyone, for coming. Thank you, Beth, for the nice intro. Today, I'm just going to go over same thing with Dr. Amin mentioned. I'm going to go over my journey with dental implants. So I got my implant training and get my license to place implants in 2017. Once I finished, I was very excited to go back to my practice. I had a small meeting with my staff and I'm like, okay, now I can place dental implants. Let's start booking patient implant placement. But when I started my first couple of cases, if I tell you there's no complication, I would not tell you the truth. The reason why I had complication, because maybe I had a good theory in my the first residency that I took. I had good theory, but the reason why I had complication, I did not know enough to, first, I had a lack of clinical skills. So the reason why I had lack of clinical skills, because the residency was not practical enough, okay? The second reason is a lack or not knowing my treatment planning, okay? So when I say treatment planning is when I go to this patient, what am I running into? What am I doing ahead of time before I go and place my implant? what type of patient, what's the state of the patient's health? What should I discuss with the patient? What consent form I should discuss with him? So even in my practice, I did not have consent forms. I did not have any forms, any criteria. Is going to be complicated, or is it a straightforward case? So all of these, I was lacking the knowledge of how am I going to go and do this procedure. I would just probably go and try my best, and then that's how I run into. And even if I place my implant, it's a successful implant, but then I face more complication restoring these implants because I did not plan my cases very well. So the most important thing about implant is you have to, placing implant is a prosthetically driven procedure. So that means you have to think about your final products, your final prosthesis before going into like the surgery, any surgical part. So you have to plan everything ahead of time. And that's how I run into these complications. And this probably will lead to loss of confidence. So when you're excited about something and you want to start, you really want to implement this in your office. And then you face these complications and you struggle, as Dr. Amin said, it will set you back and it will cause some. So the reason why we structured this course, we'll talk about the theory and versus the real surgery. So the theory is I can make a workshop and then we can place implants on typodonts and it's a successful placement, everything is fine. But when you go to real surgery, a lot more than that. There is, as Dr. Amin mentioned, where am I going to stand? Am I going to stand behind the patient? Am I going to stand in front of the patient? How should I teach my assistant? What should she prepare for me ahead of time? There is also, if you compare theory to real surgery, there is stress is the biggest factor. You're stressed. There is bleeding. You can't see. So all of this is because of the lack of clinical skills. You'll run into some issues or complications placing dental implants. So the way we structured this course, can we go to the next slide, please? Yeah, so the way we structured this course is we will spend a lot of time at the first couple of modules to discuss treatment planning. So treatment planning, Dr. Amin is going to go over the treatment planning from A to Z, starting your single implant placement, your multiple implant placement, and then full arch solutions and treatment options. Also, we will provide the theory, which every course can provide the theory. We're going to teach the basic science behind implants and what types of implants. We'll also teach you types of bone and all of this, you know, about the basic science. But also what we will be teaching you is treatment planning. We're focusing on treatment planning, not only the regular treatment planning, but we're also doing a digital treatment planning. And what does that mean is, every participant will get a CBCT of their cases ahead of time before going to the surgery. And then we would go step by step, placing your implant on a software, on digital planning. So when you go into surgery, you know exactly what you're running into. And all teach about CBCT interpretation, how to read your scans. Okay, I got a scan, I sent my patient for a CBCT scan, but what am I looking into? What things I should look into? And how can I implement this to help me throughout my implant placement surgery? We'll discuss also record keeping, and then we'll teach some photography. Photography could be part of your record keeping, and also it's good for your marketing. And then we also have Dr. Quinsu. She's our board certified periodontist. She will talk about the principles for implant placement, which that include your single implant placement and then multiple implant placement and full arch as well. She'll go over your tissue management, how to open up a flap, what's your approach, and we'll also cover some suturing technique. So after this is like the first 3 modules. After that, each participant will get a folder of all patients' chart, including patients' chart, their records, photos, x-rays, and scans to start planning before the day of the surgery. In module 4, the participant will be divided into groups, and then they will meet their patients. So everyone should know what's their plan ahead of time, what's their approach, what's their flap design, how many implants, what are the sizes. So by doing this, you would have less complications and less stress and increase your success. After healing, all the participants will expose their implants and we'll check the stability of your implant. And then in the final stage, before the final stage, they'll about the placement of implant. You will practice placing implants on the conventional way, which is the freehand. And we will also practice a fully guided placement. And then same thing with the after healing, they'll check the stability, and then we'll teach the conventional impression technique and then the digital impression technique. And then last thing is your final prosthesis insertion and your maintenance protocol, as well as any complication that you would face in the future and how to deal with them. So by doing this, you're starting the case from A to Z, you're finishing the case from A to Z. And by doing this, the goal of this residency is to increase your clinical skills and your confidence, and also increase your success and decrease your stress during the surgery. Yes, so planning. It's all about planning. And also Dr. Amin mentioned it. So we will spend a lot of time planning on models, on CBCT, and how to read your CBCT, and also how to digitally plan your implant placement. And then also all of this will help you to have less complications and everything would run smooth on the day of the surgery.
That's excellent. Thank you so much, Dr. Ali.
Thank you.
We do have some questions for you here. So
Yes.
Dr. Nadia just asked, which implants company are we working with?
So we are placing Astra implants by Dentsply Sirona, but the concept we're teaching applies to any implant, but the system that we're using for this course is Astra implants.
And Nadia also asks, are we learning sinus lift surgery too as part of the implant placement in a posterior maxilla?
Good question. So this is going to be this is going to be part of, in the theory, is going to be part of Dr. Su's lecture. And then in the past residency, we actually did 1 or 2 cases with sinus involvement. So yes, we'll be teaching, but the sinus approach is more of like a complex course, advanced course. So we'll be teaching the theory, and then also, if there is any case during the procedure, we'll be showing how to do the sinus lifting. Yes.
Wonderful. Thank you so much, Dr. Ali. So we're now going to open up to questions, and we're going to be joined by a few more guests here. So we have Nicole here, who is the manager and course facilitator for the staff portion. And I'm going to get Nicole to talk to us a little bit about that as well. So, and we're also joined by Dr. Sammy. I just wanted to check, Dr. Sammy, I did see your name pop up there, but are you here?
Yes, I am. Can you hear me?
Wonderful. Excellent. Hi, how are you?
I'm good. How are you?
I am fantastic. So I'm going to start with some questions for Dr. Sammy, because I think after that fantastic explanation about what the course covers and everything, I know I'm really excited to hear what it's like from you, Dr. Sammy, as a participant. Dr. Sammy is a current participant of the course and has completed the first 4 modules and is just about to go in and complete the 5th module. So Dr. Sammy, I want you to tell us a little bit about your experience, and we'll start with a really good question that I think everyone is kind of interested to hear, which is how many implants did you place?
Oh boy. Well, originally when I was told I have 6 cases, me and my partner, we are a group of 2. So we were 2 dentists in that group. We were planned to have only 6 cases. That's what we thought. But apparently each case had like 3 or 4 implants in it. Some of them had one of them had 4. So I actually ended up having placed in myself 5, and my partner placed, I think, another 5. So I assisted in 5 and I placed 5.
So by observing, did you find that it was also beneficial to be watching your partner and helping your partner?
Oh my God, yes, for sure. It's like you did say, instead of doing 5, it's like I feel like I did 10 now, because you see all the complications they go through, the differences, and it's completely useful for sure.
And how many had you done before this course?
I have attended another course actually before Dr. Amin's course in 2017. And I have, in that course, I placed 4 implants, if I remember correctly. I think it was 4. But honestly, after I left the course, I wasn't very confident to do it on my own. And that's what motivated me to take Dr. Amin's course.
That is the ultimate question, isn't it? I'm really glad that you said that, because now is my question is, compared to the other course that you had and this one, which you're not to even finish this course, how confident do you feel going back to your practice and starting to book in dental implants for yourself?
Oh, I already did. After we completed the surgical module, I already went back and I started placing implants on my own. And of course, Dr. Amin did not hear enough about it. Poor thing. I was texting him, emailing him about the case. So I said, well, I was planning it. I think it was a mistake giving us his email and phone number, but it's okay. He knew what he was getting into.
Oh, that's fantastic. And an example of the mentorship. So you still feel very supported by Dr. Amin and Dr. Ali as you're going out back to your practice.
Oh, they were amazing. During the course and after, with their support, it was fantastic.
That's fantastic to hear. So question around I think it's module 1 or 2, where you're working on the typodonts. So now you've done the theory on the typodont and on a real patient. If you had just done the typodont, do you think you would have known what you were doing?
No, of course not. It's completely different. Just managing a live tissue is not even close to plastic. And that's usually the main problem that I have with any course of anything, not just the implants that we've taken. If you're doing it in plastic and it's just a head that you move whatever you want, and you can play with it whatever you want. There's no bleeding, no tongue, no saliva, nothing. It's completely different atmosphere. Even just the kind of tissues when you reflect, like if it's a soft biotype, if it's a thin or a thick, biotype or something like that, even just stitching it, honestly, it's completely different.
That's fantastic. And that reminds me of something that I heard, and one of you might need to correct me if I'm wrong, but did you in this course, when you were working on the typodonts, did you actually take molds of the patients that you were going to be working on, so that when you were working on the typodonts, you were actually working on an exact replica of your patients?
Yes, actually. It was a digital model of the patient.
So I've never heard of that before.
So each of us, we got our cases, like, the file Dr. Amin was talking about. Yeah, we got a huge file. All the cases were their CBCTs and medical history, everything, all their records. So, and the pictures and everything, because these are patients that we haven't seen. It's Dr. Amin's patients. I didn't have to bring the patient with me. So they brought the patient's records for us in the course. We had a full day of just planning. That's all we did. We had the DICOM file for the CBCT. We had all the softwares. Everything was available. We did all the guides ourselves for the guided surgeries, and for the non-guided, they still made us plan it as if it was guided, so that we know what we're getting into, but we didn't make a guide. So we were going to freehand it, but they still wanted us to know what the bone looked like. So we still planned all of them. So I remember me and my partner, we planned all the 6 or 7 patients that we had. whether it was guided or not. And then we had the digital models, the printed models. We put them inside the typodont. Let's say I planned on doing patient X15 implant. So I put the model for that patient, and then I practiced placing the implant for her virtually, I should say, inside the typodont head. So when I went to the live surgery, it was of course different because it was live, but it's still like I knew what I was going, I knew my angulation, I knew everything, and it helped you relax a lot for sure.
Yeah, I bet it does. I just want to go back to the slide here. Yes. Planning.
It's so true. Oh my God. If you do this slide correctly, then everything else is a breeze.
And you were talking about the guided versus conventional. So are you glad you learned both? Was it good to know both of them?
Honestly, I think it's essential. If you want to succeed, you have to know both, because no matter how much we planned, and I'm telling you, we planned a lot. No matter how much we planned, when we went in there and we reflected that flap, there was a lot of surprises. There was a lot of a bone that was not as good as it showed on the CBCT. There was some bone defects that we did not see, or it was not shown in the CBCT. So we had to actually freehand and modify. We had to use a little bit of a different system called the denser burrs. When Dr. Amin was there, he's like, sure, let's just do this. Let's just do that. He was just like, and he wouldn't do it himself, which is what I loved. He would let us do it, but he's sitting right there at the end of the chair, cheering us on to go on. So it was very nice. I never thought I would do that myself, but with him being there, he felt confident. I'm like, he's like, what's going to happen? You're going to break the bone. I'm here, go do it. So I just do it. And you feel like courageous enough to do it. So I did all that, and it was really good. It was really amazing.
That's fantastic. That actually answers my next question, which was, how were the instructors? Were they with you the whole time? Did you feel like you were safe and secure in doing what you did? Or did they just kind of leave you and say, off you go, do it now?
Actually, that was the main difference that I noticed in this course from the one that I took before. I remember the first one I took, it was a Canadian based too, but we went into this huge room with so many chairs, and there's only few instructors in there. So I was like, yes, use the first drill, wait for me to come back, and I'll let you know when you're ready to go for the next drill. So it took forever to actually finish an implant, because you have to keep waiting for the instructor, his assistant, other people as well. Well, for Dr. Amin's course, you would go into this one room, your partner, like me and the other dentist that was with me, the patient, and the instructor. And then there was an assistant always stand by to help us. Even though I was assisting my partner or he was assisting me, she was always stand by. And then Dr. Amin or Dr. Sue or Dr. Ali were with us in that room the whole time. They would not leave us for 1 minute until the patient is dismissed. So it was amazing, because there's no waiting, there's no lag time, there's no waste of time. So I remember our first case, we finished in like 40 minutes, and I was like, that's it. And they were like, yeah, you're done, good to go. The next patient was a full arch. That one took us 3 hours. So it's like completely different. But wow. The instructors were with us the whole time. Any unexpected complication beyond our scope of practice, like let's say they had to abort, I think we had to abort one case because when we opened the flap, the defect was just extensive, and the patient was not, like, he didn't do well with the bone graft. He was a smoker. He had a lot of problems. So anyway, we had to abort. So the instructor was with us the whole time. We didn't panic. We didn't freak out. So they showed us what to do in something like that. We just had to kind of change it from an implant to just a GBR at that point and wait and do it after they said, you're going to come back in 3 months yourselves, and you're going to do that same case that you did not get to do this time. So we're still going to place that implant. We're just going to wait for the healing more.
Yeah. Well, that's amazing. Absolutely fantastic.
Really
what an experience. You got to basically do it all, but in an environment where you're safe and secure. You got to follow that patient from A to Z. You haven't even finished the course yet. You've still got 2 more modules to go.
Exactly. And I'm so looking forward to it. And honestly, even just the atmosphere at the module, like at the course, it's like you're with a bunch of friends. You don't feel like they're instructors. Dr. Amin is so down to earth, and Dr. Ali and Dr. Sue, they're like your friends. You just go in there, you chat. It's like, honestly, it was so much fun. It was so much fun. I was looking forward to every module. And now I'm looking forward to the next one.
So will the bone graft in that situation you were just talking about, is that going to be bone graft placement clinically? Would that be part of it?
Oh, yeah, for sure. Oh, yeah. We talked a lot about that and the bone grafting, how to do it, what kind of bone you use, what kind of membranes, what kind of sutures to place. Yeah, it was all covered as part of the modules.
And I think this gives us an idea of what sort of patients that you're actually working on. So because you're not bringing your own patients, from my understanding, Dr. Amin, Dr. Lee, correct me if I'm wrong, but these patients come from anywhere. They're from all walks of life. You're not going to just get easy patients. You're actually going to get an exposure to very different types of patients as you go throughout this course.
Exactly, which is actually very realistic. That's what's going to happen in your own practice. Not everybody's going to be a type A patient who's just ASA, one perfect, no medical history, no smoker. That's not the case. Like, how many of these are you actually going to get? So we got actually exposed to a lot of them. The nervous ones that needed sedation, they were sedated. There was an anesthesiologist available. We worked on sedated patients. We worked on patients who are awake. We worked on all kind of patients for sure, young, old.
That's fantastic. Absolutely fantastic. Now, I do actually have a few questions here for Nicole. Again, the person, the facilitator who is running the staff portion. So something we haven't actually mentioned yet is that for Module 5, we encourage you to invite some of your staff, I believe up to 3 staff members, to attend for the day, and they will be working with Nicole. So Nicole, I was wondering if you could tell us a little bit about what the staff are going to get out of this.
For sure. Thank you, Beth. So as Dr. Amin said, it's a 9-month program. The staff, we're encouraged to ask the dentist to bring some staff, dental assistant, treatment coordinator, office manager, to Module 5 after the surgery. And certain things we're going to cover for dental assistants, implant instruments, parts and pieces, implant terminology, how to set up a sterile operatory room, follow up with patient, treatment coordinating, how to speak to the patient to understand the value of the treatment over the cost of the treatment. So this is a really important thing. Codes for implants and fees, financial planning, and we do have some financial companies that could assist. And if it was a large cost treatment plan for the patient, we could help with that and recommend somebody that we would use. I honestly believe that if your staff is well trained in the implant, like especially your dental assistant, your treatment coordinator, your office manager, they need to be all on the same page with you, because this is going to help you just like talk about the value of the treatment over the cost of the treatment and grow your practice.
Yeah, I can't remember who mentioned it to me, someone in one of my many conversations about this, that it's not a one-man job. It's a team effort, and from the patient's perspective, it's not always working with the dentist or with the surgeon. You are talking to your front end staff, your receptionist, you're working payment plans with the patients. You've got dental staff who are setting up the room for you. Now, I can only imagine what it must be like if they put something in the wrong place and you know, you need something at a moment's notice. So I think this part of the course is a very interesting piece. I don't know of any other course that invites the staff along to have a session and talk about dental implants and supporting their doctor for these dental implants. I think this is absolutely incredible.
Yeah, and we'll have the implant kits there for the staff, like the dental assistants who are in the op with the dentist, to be more familiar with the parts and pieces, right? Because it's new to everybody, because there's all little, they can be lost very easily, trust me.
Little pieces.
Drills, they got to be put in the right spot. Like, we're going to teach them this, and as I said, the treatment coordinating and the office manager for financial planning.
That's fantastic. So I do just want to do a time check here. We have about 8 minutes left of this Q&A. I encourage you all, if you have any questions, any pressing questions, even if something's already been discussed and you just want a little more information about it, post it in the chat and I'll make sure that we get the question. You can direct it to a specific person, or you can just ask it general and we'll ask the question. So yeah, we've got about 8 minutes left, and like I said, this is being recorded, so you'll all have access to the recording, and yeah, we'll start to wrap up. So Nicole, again. Oh, yes, sorry.
Sorry, can I add something to what Nicole is talking about, like the staff? I forgot to mention something about the case presentation. So when the patient comes in, first of all, it's a stressful procedure for the patient. Second of all, it's a costly, it's expensive. So if you are the best surgeon in town and your staff does not know how to present a case for you, you're still not going to be able to be successful in your implant journey. So that's also what I faced when I first started dental implant. Is it's not only you, it's your whole team. How to present your case. Even for the dentist, they need to know how to present case, but the most important part is the staff and the treatment coordinator to present your case.
Yeah, if we're all on the same page, like I said, to discuss the value over the cost.
True.
Yeah.
Really give that to the patient, to learn how to speak to the patient regarding the value over cost of treatment.
Yeah, it's a huge piece. I know I personally have chosen to go for a more expensive option because the staff have spoken to me in a way that made me feel special, you know, and
this is true actually, because Nicole usually assists me in my cases. So it's funny when it comes to financial, she tells me, Dr. Amin, get the door out. Don't even talk about money. So I've been practicing 23 years. I've never ever discussed financial with patient. And because we dentists, we know how to do dentistry. Business part, unfortunately, we are not trained enough to do the business part. And that's why we are going to also bring some a company for you guys will give session about how to present yourself to the community, how to advertise for yourself, how to bring more patients of implant there. It's not about just learning implant. We want you to have, as Dr. Ali said, a full package of, you know, A to Z, bringing those patient treatment plan and you know, placing implants, following up. And to me, Beth and I guess Nicole mentioned something. These are little parts. They can be misplaced. Believe me, if they are misplaced, you will end up with like really like big complication, because it happens. If they put drill 1 in the place of drill 2, that can be a big issue, a big issue sometimes, especially in guided surgery. So yeah, that's my actually a big part, which I will talk about complication, because I think I have attended many courses. Complications is really missing, because you know why? Everyone wants to show the good cases, all implantologists, and I don't blame them. But to me, I'd like to show the bad cases. How did they you know go, and how did I manage them? And in my opinion, I would say the more you place implant, the more issue you will face. The success rate is 95%, which will really make you feel very confident. Though I still believe, as Dr. Sami mentioned, not all the cases is a patients. You'll find different cases, different difficulties, and when the complication happen, this is the best part, I believe, in the course, because that's what you need to know.
Yeah, it's so much easier to go out in the real world when you've done the hard part, and then you just, you know, everything else just seems easy because I've already done a complicated one. You know?
If I may add, Beth, that was actually one of the problems that I had with the previous course that I attended, is that they show you all the nice results, not the bad ones. And then when it came to the complication, it was a 1-hour lecture. That's all that we learned. So we ended up like placing implants and you're facing all these complications. I remember the first one I tried to do after the course on my own was a complicated one. And at that point, it really discourages you when the first one you place after you're done does not work as planned, right? Well, if they discuss complications more, that would be way more realistic for sure.
Yeah. We just had a question here. I didn't want to miss it. I think it was slightly discussed a few minutes ago. Does the staff portion cover treatment presentation?
Yes, we will go over treatment presentation. That's all with the treatment coordinator. We'll go over how to speak to the patient, booking sequence, because there's several appointments, right? We're gonna discuss with the patient when the patient's going to come in, what's going to be done during that appointment, and then the case presentation and how to, again, my thing is it's the value of the treatment, not the cost.
Absolutely. So we just have one more minute. So I think we're going to wrap up, and I'm going to just ask the most important question from my perspective, which is, how do I register? So please visit us at hightechdentalseminars.com. There is a nice big button there saying register now. We don't ask for payment immediately. We just ask for your information, and then from there we'll contact you to arrange payment. And actually, sorry, Nicole, we did have one question actually, which was, do you do a payment plan?
Yeah, we can do 3 installments, 3 equal installments, and we typically at this moment are doing e-transfer.
Perfect. Yeah. And we did have another question come through. You don't need to be licensed in CBCT for this course because we're not taking them. We are just doing interpretation and that it taught in this course.
Yes.
That was actually Nick's question, Beth. I just replied.
Oh, thank you.
We have to be licensed, and I'm like, no, we are going to be taught how to read the CBCT scan, but we're not actually pressing the button and taking them. They're just going to be, the DICOM files are going to be handed to us.
Yeah.
Right. Nope. And I think also if you're not licensed in Ontario, there is a temporary license that you can obtain as well. Is that correct?
So this is for the surgical part. Like if you're not licensed in Ontario, you can call us and we'll guide you through temporary licensing. Like let's say you're from Manitoba or from, let's say from Vancouver. You still can register for the course and you can apply for temporary license in Ontario. Then, yeah, you can attend the course and do the surgeries.
Wonderful. Okay. Well, we'll wrap it up there. It is time. So thank you so much to our presenters. You did an absolutely amazing job. It was wonderful hearing from each of you. Thank you, Dr. Sammy, for attending, and Nicole as well for our questions there. It was very useful to have your insights there. And thank you to everyone for attending. I hope that your questions were answered. If you have any more questions, you come up with questions, please do not hesitate to reach out to me, info@hightechdentalseminars.com, and always feel free to visit our website, hightechdentalseminars.com, for information on the upcoming workshop. Thank you very much, everyone.